So thank you all for joining us. I'm just going to give you a quick overview of who Whitefoord is and the Region 4 Training Center who is putting on the webinar today about health equity in young children. And then I'm going to pass it over to Whitefoord CEO, Dr. Jean O'Connor, who is going to do the bios and be facilitating and moderating our questions today. So Whitefoord is a community-based and driven nonprofit federally qualified health center, and we are dedicated to providing healthcare through school-based health centers and in community settings with a focus on promoting health awareness, encouraging healthy families, and advancing early child development. And our mission is, this is a new mission, so I have to read it, is to create health equity by delivering patient-centered health services complemented by other programs, especially early education that address the social determinants of health. And if you are interested in finding out more information about Whitefoord and what we do or getting involved with us, you can visit our website at whitefoord.org. And also, in collaboration with Whitefoord, the Region 4 Public Health Training Center is hosting this webinar, and they are one of 10 public health training centers funded by HRSA to provide trainings and resources for the public health workforce. The collective group of centers is called the Public Health Learning Network, and they work to improve the nation's public health system by strengthening the knowledge and skills of the current and future public health workforces. They serve 8 southeastern states, and their central office is located at the Rollins School of Public Health at Emory, in addition to 7 community-based training partners and 3 technical assistance providers. They provide public health workforce trainings and student field placement. And for more information, you can visit their website for upcoming trainings as well as archived recordings of past trainings. And I will make sure to email you out our Whitefoord website as well as the training center's website so that you can have access to those. So I'm going to stop sharing. Hold on. Oops. And I am going to pass it over to Dr. O'Connor so that she can introduce our wonderful panelists today.
All right. Well, thank you so much, Allie, and thank you to our panelists. We're really excited to have you with us for this conversation over the next 50 minutes or so, and to have our audience with us as well. So I'm going to introduce each of them, and then we'll dive right into some questions. So first, we have Kimberly Ross, who is the Early Brain Development and Language Acquisition Senior Manager at the Georgia Department of Public Health, where she provides leadership in the management and coordination across the state, bringing together government, philanthropic leaders, academics, and business communities to address early brain development, language acquisition, and developmental health among Georgia's children. Before this role, Ms. Ross served as the Deputy Director for Government Relations and In-Health Communications at DPH. She has a bachelor's degree in Public Relations from the University of Georgia and a Master's of Arts in Communication and a graduate certificate in Public Health from Georgia State. She resides in Kirkwood with her daughter, her husband, and 2 cats. We also have been joined by Denise Mayhan. Dr. Mayhan is currently with the Talk With Me Baby project. She is the director of that project at Grady Health System here in Atlanta. Talk With Me Baby is a language-based early brain development program designed to educate parents and caregivers about how to help their babies build capacity for lifelong learning and health. And in this role, Dr. Mayhan works collaboratively with the Rollins Center for Language and Literacy in the Georgia Department of Public Health. She serves as the CEO of Inspired Solutions Enterprises as well, a management, education, and technology consulting company. Her passion is developing and implementing initiatives for healthcare and education professionals and organizations that improve professional competency, organizational effectiveness, and create opportunities for making life better for the people served. Dr. Mayhan has a bachelor's in occupational therapy and a PhD in education, as well as a master's degree in occupational therapy. Exciting and talented. Thank you for joining us, Dr. Mayhan. And then also we have Ellyn Cochran with us. Ellyn is the Senior Director of Early Learning and Child Development at the United Way of Greater Atlanta. She manages the United Way's investments on improving outcomes for children 0 to 8 with a focus on ensuring children enter school prepared to succeed and on a path to read by 3rd grade. Prior to joining the United Way, Ellyn was with GEARS, the Georgia Early Education Alliance for Ready Students, where she was the Director of Innovation Strategies, leading the state's work in supporting new and creative research programs. She facilitated the launch of Georgia's relationship with the Center on the Developing Child at Harvard and is partners in Frontiers of Innovation. Originally a Midwesterner, Ellyn moved to Atlanta from Baltimore, where she served on the family engagement team and was the assistant to the CEO in Baltimore City Public Schools. She has worked on education policy in state and local governments, and she has experience in international development as a U.S. Peace Corps volunteer in the Ukraine. She has a master's degree in public policy from Johns Hopkins and a journalism degree from Iowa State University. We're so delighted the 3 of you could join us and excited to have you here to talk about early childhood and health equity, and I just can't think of a more appropriate time for us to be having this conversation. Given everything going on in the world, you all certainly have your work cut out for you, and I'm sure in your positions are seeing so many things across Atlanta and the state and even nationally in terms of what's going on right now in early childhood. So maybe we'll just get started and hope we can have a conversation here, but we'll just dive in with a question. What do you see as the kind of greatest challenges and opportunities for equity in early childhood right now, given all that's going on in the world? Would someone like to go first? Ellyn, you want to go first?
You know, I'll always go first. Hi, everybody. Thanks for having us here today, Jean. I'm excited to be a part of this conversation. So what I will say is at the United Way, as Jean said, my focus of my work has been on early literacy. And so when we think about health equity in early literacy, what we're really thinking about is the things that are getting in the way of children being prepared to succeed in school, those needs of families. And so we see that as a huge part of our Strong Learners portfolio, that ability to have health navigation, health education for families. You know, when we look across our region, or actually across the country, we're looking at like 13% of all students missing 15 days or more of school. Well, that starts in preschool. That starts at a very young age of kids missing school because of chronic health issues or behavioral health challenges that families don't know how to deal with. And so when we think about health equity right now in our space, we really need to think about what access looks like for our families. If we look at the disparities between people of color and low income in our region, and we look at COVID and who it's hitting, we really have to start to talk about what does access look like in communities, not just in setting up those points, but in equity, to think about how do folks get to those access points? What is the understanding of education within our communities? So I think the biggest challenge for us right now is really recognizing where communities are in terms of access, in terms of understanding, in terms of the barriers that get in the way of children being successful, and how we help families be able to do that.
So piggybacking on what Ellyn just so eloquently stated, I concur, 100%. I also believe that when you look at health equity, it not only means that high quality services are available, accessible, and affordable to meet the needs not only of our children throughout their entire childhood, but also that those same services are available to women of childbearing age, expectant and postpartum moms. Since we're talking about young children who are dependent on their parents or caregivers, the healthcare system should also support them to ensure that they can get the care that they need for themselves to stay healthy, so that they can get care for their children as well. So considering things like supportive services like transportation, access to healthy food, readily available consultation and in-home support when necessary are also really very important.
Yeah, and I'll just add, I agree with both of you. Just to add that as programs have been moving to kind of this virtual world, we need to ensure that we're not leaving families behind. There were some programs that quickly shifted to providing services through using technology, but to ensure that we're not missing families and they're no longer receiving services that they would have if they were able to go in person kind of in the pre-COVID times.
So let's talk a little bit about access, because I think you all kind of mentioned that. And in terms of sort of, we had challenges in access before to services, and now we have, we have layered problems on top of that with COVID. Talk a little bit about, in an ideal world, what would access to services that promote healthy early childhood look like? If you could dream it up, and I'm sure that you've spent some time thinking about this, what would that look like if we were trying to create a healthier space, especially right here in Atlanta?
Jump in with that one. Everything that we do when we think early brain development with the Department of Public Health and our Brain Trust for Babies, it's early everything. So that's starting with early language exposure. That's in utero, mom talking with baby in utero and building a language-rich environment, to early screening. So the newborn screening that happens in the hospital, the newborn hearing screening that happens in the hospital, that then leads to an early diagnosis if there are any issues there. And then of course that diagnosis is early access to intervention and any resources that a family may need. So we need to ensure that families, in order to meet all of those pieces early, have access to the care that they need, the resources they need. So mom, has access to good prenatal care, access to timely follow-up after screening, and then the biggest thing is access to early intervention after that screening and diagnosis. We can screen and diagnose all day long, but if we don't have the services for families to be able to meet them where they are, we might as well not screen and diagnose, because you're really missing the mark and you're leaving families with what they need. So my ideal world is we have this big ecosystem where everyone is communicating all of our services, which we do a really good job of in Georgia, I would say. But we could always do better to make sure we're not losing families as they move through services, as they move through our programs, and ensure that their children are staying along a path to help them in their early brain development.
Yeah, I will just jump in to say, agreed with Kimberly. What does that look like so that kids and families have access from the very beginning and early? I think one of those, what do we do now in the state of COVID, is that these conversations don't just exist within the healthcare space, right? That we are thinking about the role of our early childhood educators, that we think about the role of our family educators, that we think about those basic needs providers, that we're all thinking about what does a systemic access point to early intervention look like? How do we refer families to services? Where are they hearing that message? Is it only from their pediatrician? Are they hearing it from their child's teacher around the importance of early intervention? I always hear folks say the phrase, parents are their child's first teacher. Well, parents are also their child's first nurse in the way of nurse navigating to services, right? They are the first ones that are listening to what's happening with their children. If they understand and know more about what is appropriate developmental practices with children, they'll be able to better understand when they need to navigate to services and be able to have a host of folks they can reach out to help them navigate where to go for those services. I think that one space where families can go to get referrals doesn't exist in our communities in a way that families can access it.
Well, I think that, again, piggybacking on my two colleagues' comments, the healthcare system really, I think, is a natural access point for getting parents education and coaching from prenatal to postpartum to well baby care. I think health professionals are in a uniquely powerful position to help influence parental interactions with their children, as well as monitor the child's development over extended period of time during early childhood. A lot of parents, or parents who understand already how to engage their children effectively through language and loving words and affirmations and facilitating secure attachments and a sense of well-being. We know that that helps their child's brain development and helps them to develop resiliency and self-confidence that will help get them through challenging times like we're experiencing now with the COVID pandemic. And some parents, I think, inherently understand how to do that because that's how they were raised. Other families, I think, need to have more opportunities for education and coaching for either brief or extended periods of time to help them to develop those habits of interacting with their children that we understand are the most effective in getting the good outcomes that we're looking for. So yes, I think that, you know, our entire community needs to engage in this, that it's a healthcare issue, that it's an education issue, that it's a community services issue. With the ecosystem that Kimberly referenced earlier, I think we're getting there in terms of getting the word out about the importance of early brain development and what we can do to influence that through a number of different venues and organizations. And I think that's really, I think, the power of a community approach to solving this problem.
So it's really interesting. And so we've been talking about kind of the big ecosystem and access, and that we've made a lot of progress here in Georgia, which I also really believe to be true. I'm wondering though if we can talk about some specific examples of some of the projects. And Denise, you're the director for the Talk With Me Baby project at Grady. Can you talk a little bit about what does that actually mean? So what's happening in the hospital system and the health system as a result of that project?
So what we're doing at Grady is literally making parent and caregiver education and coaching on language nutrition a part of every healthy pregnancy and delivery. That is what we are striving to do. Parents need coaching and practice as well as education. At Grady, what we've done is educated and coached up our nursing staff members and our other healthcare providers to enable them to educate and coach our parents on early brain development and language nutrition as they're receiving their normal routine care. In addition, we're trying to create an ecosystem on our units where everyone gets involved. Environmental services, the people who deliver trays to our moms. We are all encouraging them all to engage babies in conversation as a way to model what it is, the behaviors that we want our parents to emulate. At Grady, one of the things that's really super exciting is that the leadership of Grady have really embraced this program tremendously to the point where now we have a Talk With Me Baby segment in the new hire orientation for all Grady employees. Grady hires or has been hiring literally thousands of new people each year. So can you imagine that impact of thousands of people each year in the greater Atlanta area hearing about and understanding the importance of early brain development and early language nutrition and its potential for long-term impact on learning and future opportunities for our children. You know, it's pretty mind-boggling when you think that Grady could be sort of the epicenter of doing something like that in the community. But that's really where we are right now. We're finding that, you know, parents do absolutely need a lot of coaching as an encouragement because we're looking at changing patterns of behavior that, you know, over time, we're hoping will result in better outcomes for our kids. So that's what we're about at Grady.
That's great. That's a really great opportunity, and having a tremendous impact already here in Atlanta. Kimberly, I'm wondering, that's an example at Grady, and you work on kind of the I Talk With Me Baby idea across the whole state, and encouraging health systems and others to try to incorporate that into what they're doing. Can you talk a little bit about some of what you're seeing happening across the whole state? And then also, can you help us with the link between early literacy and language acquisition and kind of this bigger picture question about health equity? Can you talk a little bit about that?
Sure, yeah, and I can start there and then talk more about Talk With Me Baby at the statewide level. So the research demonstrates that the language environment of a baby is a predictor for their third grade reading success. So the richer the environment, the more language rich interactions, the quality and quantity of the words that a baby has in their life, that first 3 years of life. So we talked about from pregnancy through age 3 is a predictor for third grade reading. And then we care about third grade reading because it's a primary predictor for future high school graduation. So if a child is reading proficiently at the end of third grade, he or she, or if a child is not reading proficiently at the end of third grade, he or she's 4 times more likely to drop out of high school. And if that child's in poverty, that child's 6 times more likely to drop out of high school. And then we care about high school graduation because it is a significant determinant of health outcomes later on. So heart disease, diabetes, obesity, substance abuse, cardiac and mental behavioral health issues. So it's kind of this staircase where if we're looking at these health outcomes later on and we back down the staircase, we have these health outcomes that are ideal. We want these good health outcomes. You need this education, which then you back up to third grade reading, but then you back that all the way up to a pregnant mom and what's happening to the language exposure of that baby in utero in the first 3 years of life. So the Talk With Me Baby program is all about building that language rich environment for those babies. And so, and Ellyn mentioned that she hears parents are their baby's first and best teacher. We say that all the time, so she's probably heard it from me a ton. But parents are the baby's first and best teachers, but we know that babies are also in the care of other people in those critical years of 0 to 3. So with Talk With Me Baby, the idea is that we build an ecosystem, which I'll probably say a lot, where every touch point that a family has with their baby, there's modeling or coaching of these language-rich environments. So if a family goes to WIC, which is a service of the Department of Public Health in all 159 counties in Georgia, they are exposed to language-rich environments. The person greeting them when they walk in the door greets the baby first and then asks mom, or says hi to mom, but is greeting the baby. And then the nutritionist is modeling language nutrition along with talking about all of the wonderful things we talk about in WIC. If that family goes to an early care and learning center, we have trainings that help build language-rich environments in those centers so that when parents hand off their baby for care for the day, they know that that baby is still surrounded with this language-rich environment and is going to continue those back and forth interactions throughout the day of that baby. And then when they hand baby back to parent at the end of the day, those conversations continue. So we think through these different touch points. At the pediatrician, what kind of interactions are happening there? There's lots of the language-rich environment there. We work with Reach Out and Read, who helps build these language-rich and literacy-rich environments through providing books to families and having developmental conversations with the families about that book and that child. We have programs or trainings through home visiting, we have programs for women who are incarcerated who have babies. So when they still have those visitations with their child, they're still having those rich interactions with that baby. So it's really about how do we make sure that anywhere this baby is, as they kind of go throughout their world, they're surrounded by language. We don't want to put all the pressure on the parent to make sure they're ones that they're talking all the time with their baby. We support them. We ensure that everybody else in that baby's life is also supporting that environment so they can have their really best start.
Thank you.
Just want to say, so I actually worked with Kimberly previously on some of the Talk With Me Baby work in the early learning centers. And one of the things that I think is great is that the state and our partners are not only thinking about the ecosystem from a systems level, but really getting feedback from, we did focus groups at that time with the Talk With Me Baby and early learning centers, but also, you know, at the United Way, we're focused on place, right? And what does that look like in particular communities of place? The feedback from community members on those touch points, because I think we need to acknowledge that all of our communities look different, and the experiences in our communities across, from my perspective now, across the 13 counties is different. And being able to have some feedback from those communities on, and I'm excited to see so many people on this call today thinking about this from their own community perspective and where those touch points are for families in their communities. So when we start thinking about the need for families to receive coaching and understanding the critical importance of these first few years in a child's life and in building that serve and return relationship, that we're really thinking about the unique assets that communities have for families and are building them into the ecosystem for that particular community. So I think the work that Talk With Me Baby has been doing in the system space, and we were excited to be a partner of that work. We are thrilled to see also be a part of community-based conversations in driving that ecosystem from the community lens as well, and raising up what's working and what's not for families.
Great point. And that reminds me that kind of our next evolution of Talk With Me Baby is that communities are coming to us and saying, we want to do this as a community. So that's not just a pediatric practice saying, oh, we want to do this at our 3 locations, or some early care centers saying, we've heard of this, we think it's great, we want to do it. It's, you know, all of a community coming and saying, we want all of our teachers trained, we want all of our practices implementing this, we want our home visitors doing it. And it's, since it's coming from them, it's not us swooping in and saying, here's a great thing that you can layer through all of your services. They really want to do it. They do see the importance of building that early foundation. And it's just this great new way to approach implementing this kind of work.
So let's talk for a few minutes about kind of closing the disparities gap. I mean, I think many of us know or are familiar with the research and the data around the achievement gap in schools, where children from, you know, in communities of color are, as compared, you know, with white children, non-Hispanic white children, there's an achievement gap that we see across the board. How are some of the things that we've been talking about, and Ellyn, you may have some other programs you work with too, but how are some of the things that we've been talking about going to help us as a state, as a community, with closing that achievement gap? And what else do we need to be doing to really create these communities? Not just, we know we need language acquisition, but what else do we need to really create more equity in early childhood so that we can close those achievement gaps, have close health disparities gaps, and increase health equity across the board? What do you think?
I can just start to weigh in, and we can just jump back and forth a little bit as I work out my thoughts a little more. But I will say that I feel like that the conversation we just had is a start to that, right? That part of this is really on addressing the unique needs of communities and on raising up the assets that exist in communities. Because I think that when we look at our child well-being index and we look at 500,000 children living in communities of low or very low child well-being, you see huge racial disparities in those communities from those communities that I would say are in the green or the that are not facing that same issue. And so I feel like part of this is around building up community leadership and understanding the real context of what's happening in communities and building on those assets. And it's also really focused on the leadership pipeline from within communities. You know, as I look at the number of our staff, people of color that are working and communicating with children across our region, and I start to see the leadership pipeline in that lens, I think that we really need to start thinking about and supporting agencies that are really focused on addressing those inequities from within their communities, from raising up leadership, people of color from within their communities, to really start to advocate and understand the communities that they serve.
I can
Denise,
speak
what do you
from the great, I'm sorry.
No, go ahead. I was going to ask you what you think, because you're in direct contact all the time, right, with people in the community. So,
Right. So what I think we're doing really at Grady is laying a good foundation. And what we need now, I think, is to work on sort of building the house. What we need to work on now, I think, is a better method for handing off what we've done at Grady in terms of Talk With Me Baby education and coaching to the healthcare professionals and organizations and community organizations that our parents will come in contact with in the next stage of the continuum. I mean, that whole ecosystem is literally, you know, it's organic, it's growing, and it's coming together. But I think we're at a stage now where we need more of a concrete path for moving our families forward. We are starting to work on this at Grady through our neighborhood health centers and other health centers that we know our patients are going to once they leave Grady. But it really needs to be, I think, a larger community effort to help in that handoff. I also think we could do a little more in the way of program evaluation to identify the strategies and resources that we're finding most effective in helping families with changing their behaviors and interactions with their children, and to begin to measure the impacts of the parent coaching and education on the development of our babies. I think that will give us much more information so that we can have a more focused and really longer term effective approach.
Kimberly, do you want to add anything?
I can just echo Ellyn and Denise in agreement with them. The handoffs, I think, are critical. If we kind of lose families, we can all in bubbles be trying to support families, but then try to lose them as they move between bubbles, and that is what kind of worries me about the work that we're doing. It's like we feel really great and we're doing great work, but do we know where those families go next? And are we sure that we know there's a bubble over there, are they getting there? And so just making sure we have those connections and ways to know that we are supporting families through everything, even if it's kind of outside of our space. What I would love to see.
Terrific. And so we are going to be taking questions for the panelists from the audience. And so if you'd like, you can use the chat box or Q&A to ask questions. And we'll get those read out here to the panelists. But while we're waiting to see if the audience has questions, I want to ask you also, though, I mean, we've been talking about this connectivity and, you know, the importance of early childhood to lifelong health equity. I mean, we're facing right now really a massively challenging situation. And for all of the people in the audience, all of us who are parents or caregivers, you know, this idea of healthy early childhood when we're struggling with how do we work if we don't have access to schools and those kinds of things. Talk a little bit about how you see resilience and recovery from COVID. I mean, there's been a lot of conversation as well about, you know, the impacts of shutdowns from COVID on the early childhood ecosystem. And talk to me a little bit, if we're, you know, hopefully going to maybe see a vaccine or some other end to the pandemic, you know, in the next 12 months or so. Tell me how you see the resilience and then recovery looking. What could we be doing to help the ecosystem and then also the children and families in that ecosystem with what's happening now?
Well, I will say that one of the things we have to start doing is really working hard to buffer what's going to be the impact of whenever we get to that point, 12 months or 18 months, or hopefully 6 months from now, when things can resume to maybe more normal. But what I'm really concerned about is, how do we buffer as much of that impact and the growing disparity that's going to be happening in our outreach to families? You know, it happens first in the public schools in terms of digital access and families having access or not having access. I think my colleagues would join me in saying the same is true with healthcare. You know, we can talk about the importance of telemedicine, but if we have families of young children who have no way to access that telemedicine, and that is the way that we are serving families now, it is going to create such a divide to address in terms of recovery, that I feel like we could really prioritize that, you know, and I'll use that digital divide term now, so that at least, at the very least, we are thinking through access points. I know that we have been working in our region with school districts, but also in the early childhood space with Power My Learning, to say, you know, I am not in the space of trying to give devices to children, because that, you know, I think my colleagues would join me in saying, that's not how children learn best. It's through serve and return relationships. But parents need access to those resources, and the resources meaning the access to telehealth and navigation, the access to activities they can be doing with their children to support serve and learn that's happening at home, the access that they need as their children get into and move into public school. And I think, you know, that is something that is at least an easier thing for us to think through, is how do we at least make sure that our families have access to the materials that are out there? Whether we have the ability to make sure everyone is using them effectively, or the best way to make that happen. But at there's a basic need thing with technology at this point that to me falls in the same category as transportation and food, that at this point, technology is one of those basic needs that needs to be addressed.
Denise or Kimberly, what do you think?
I think it's going to be important for providers in any area, so early childhood, healthcare, wherever they are, to be prepared. So Dr. O'Connor, you mentioned if there is a vaccine and the world kind of returns to more of a normal, what does that look like? To be prepared for what trauma there may be in children who have experienced this, in families, but specifically here in children. And there's great resources out there. There is an organization, Resilient Georgia, that has put together a matrix of trainings, depending on what provider area you're in and where you are, where your community may be and what their needs are, of what trauma-informed care training is already out there, already available, a lot of times free, for workforces. So just, I mean, to be thinking of that now, what do we need to do to prepare for seeing families more, for seeing these children? There are these trainings available, there's resources out there, and just to, you know, access those, really think about what your community needs and what your community will need as time goes on, and just, you know, be as prepared as possible.
Mm-hmm. Yeah, I think that we really can't even begin to imagine what it is we're going to be faced with as things start to return to normal. And I think that, you know, really just to echo what my colleagues have already said, trying to anticipate what those impacts are and being ready with the resources that our families are going to need is, you know, the right way to go. Other than that, I don't really have a whole lot to add to that. I do think that currently, though, as we are experiencing the pandemic, that we really need to, I think, do more to get resources to our parents where they are right now. And I think that in many ways, this pandemic is forcing us to rethink the way we provide care, the way we provide services, the way we provide education. And not all of it is bad. And some of it we're finding is actually better than the way it was before. And I just think we need to continue to explore those avenues for getting services to our families, and just to continue to pursue them and not give them up once this miracle vaccine or cure comes on the scene, because I think we're learning a lot about what people need and how people need to receive it as we're going through this this major pandemic.
So we've had a couple of questions come in, and I'm gonna read you one or two of them a little out of order. One related to what we were just talking about. So one of our audience members said, how do we engage parents in these early development ecosystems when we know that these families or individuals have compounding issues, impoverished individuals who might be dealing with systemic racism, joblessness, poor substandard living conditions? What are the strategies for bringing resources to these families, especially around early childhood? Or is this an area we have a lot more work to do in?
Well, I can start. At Grady, we do have healthcare workers who go into the community. And I think that that's a really powerful resource. I think that one of the things that we can do is to help parents understand that even in the midst of all that's going on around them, that they really are responsible for helping to create that sort of bubble of calm for their children. And that they have the power to do that in how they react and in the language that they use around their children and how they interact with their children, to give them a sense of calm and really to help build that resilience. I think that Talk With Me Baby really has a lot to offer in that capacity. But yeah, I think that that's definitely one thing that we can do to help.
You know, I think this really gets into some of those conversations on partnership and community. And when we think a lot about our work in place in Atlanta, and we think about the early childhood system, what we recognize is that an early childhood system and an early childhood provider and a healthcare partner are not alone in this work, that this is work that really takes a community-wide approach for those agencies that are thinking through food security, through housing transition and mobility, that we not have any expectation that there be one agency that's a panacea for communities. And I think that's really important to think through in this work. And I think the person who asked about what is this, I didn't know the person, but the person who asked the question around what does this look like in supporting families in this, you know, one of the things that we have done at the United Way is really support agencies in thinking through the network for families and thinking through, we all need folks to talk to and work through in our own goal setting, that sometimes around early childhood and health education, it's around really supporting the families in their own goals and making sure that part of those goals is around that safe buffering relationships for children, the safe, stable, nurturing relationships that children need. And so recognizing that you're not just coming in with one solution or idea or conversation, but working with families to set their own goals based on what they know and how to help them understand the context of child development. And so while I'm still worried about getting my lights on because I've just lost my job, that is, I still need to be able to work with other families in my community and connect with folks on how am I handling this while still being a parent to a child who is 2 years old or 3 years old in my space, and what are things that are going to be toxic in that relationship, and how to buffer that. And I think that's where we've done a lot of grants to a lot of organizations who are saying, we want to bring our families together in a cohort, and then we want to help them work together to access need within the community, because they know where to go when they're having trouble with their bills, or they can call 211, for example, at the United Way. Like, we're trying to think through how can those families really connect to address their own, address the own challenges that they're having in their communities, because they're the ones that know it best.
Okay, well, there's an interesting thought there in terms of how can we really support those families. We have a couple of other questions. One is around asking about the impact, and I assume they mean the impact of kind of this whole situation on children with special needs. And then also there's a question here about services for incarcerated women.
So I think the question about the women who are incarcerated may have come from when I was talking about our Talk With Me Baby ecosystem. So a piece of our ecosystem, we do have a part of a curriculum that has been incorporated by a faculty member at the Emory School of Nursing. She works with a program, runs a program called Motherhood Beyond Bars. So it already has a set curriculum of working with mothers who are incarcerated. And so we were able to fold in the Talk With Me Baby curriculum into that. So along with the other kind of motherhood topics that they're discussing, there is coaching around talking with their baby, the importance of building that language-rich environment, the importance of that connection and serve and return and responsive interactions into building their brain. If you want to look, I think there's resources online about Motherhood Beyond Bars, or I can find stuff and send it to Allie to send to members if you want more on that about the curriculum as a whole. But the way we partnered with them, partnerships, to incorporate that curriculum specifically for Talk With Me Baby into their existing curriculum.
And that's a great example, Kimberly, of the importance of partnership and trying to create that ecosystem. I know that we have another grantee, Fathers Incorporated, who has also been working with incarcerated fathers in that language on safe, stable, nurturing relationships and the importance of language nutrition with young children. And I think that's a great, again, to that message that it takes finding new, sometimes one of the biggest opportunities we have here right now is thinking through what might be some new partners in our communities that are doing work and bringing them into our ecosystem conversations.
And there was one other question, Kimberly. Someone asked if you would repeat the piece about addressing trauma in children.
The matrix. The Resilient Georgia is the organization, and they have a training matrix where you can kind of look at the community needs and provider type and identify kind of links to existing trainings that are out there. So Resilient Georgia.
So we are almost out of time, and to close us out, I wanted to ask each of our panelists if they wanted to just say a few more words about what they see going forward as the opportunities for us as a community here in Atlanta, maybe as health professionals, education professionals, or others, to really promote health equity for young children. Is there anything else you'd like to say just in closing?
Well, I'll get started. I think that kudos to Kimberly and her team at the Georgia Department of Public Health. I think they've done a great job at keeping all of the official Talk With Me Baby constituent initiatives kind of rounded up and sharing collaboratively. And just in the short time that I've been engaged in this group, I've just seen some wonderful projects come out of it and some really great collaborations and partnerships. So I'm really excited about the creativity and the enthusiasm and innovation and support this initiative really has from so many different organizations and perspectives and situations. I do think we have a great opportunity to just sort of start putting our heads together to thinking about more strategically around the handoffs from one organization to another, and which community organizations we need to engage in those handoffs so that we can create a more supportive system with maybe fewer gaps for our families and our children. And I'm really excited to be a part of helping that to come together.
Thanks, Denise. You said some of my favorite words: collaboration, partnerships. Like it's what we are all about in public health. We can't get our work done if we stay in our little DPH silo. So we rely on those partnerships. And so don't be afraid if you're out there and you feel like you are in a spot and you need to know what resources to connect families to, or how to access trainings, or how to serve a family that's kind of outside your specialty. Reach out to community partners around you, reach out to your state resources, whether it's us in public health, or a DFACS or a DECAL, Department of Early Care and Learning. We're not scary state employee people. We are here to serve, and we really are all about partnering. So the opportunities are there. And if you reached out to me and you have questions and I don't know the specific answer for you, I would know who to connect you to, because we all know each other. So just really think about how to use other folks in your community and at the state level to support you, to support your community and your families.
Yeah, and I can't echo that enough. This has been a great conversation that really raised up the importance of collaboration and partnership and community involvement. And I think when you ask about what communities can do, what I keep saying to our grantee partners and to our strategy partners is really around, what does community partnership look like in your space? That when we think about strong learners, like I said, we think about those folks that are doing health navigation. We think about folks who are providing access to early learning, whether it be that access is in high quality early learning center-based care, or whether that care be within family, friend, and neighbor care, and how we make sure that those folks are also connected to this ecosystem. How do we reach families where they are? And so the importance of making sure that no agency in our network is working alone, that families are connected to the ecosystem in multiple touch points from where they are, is just a great conversation to take into communities moving forward. I know that we at the United Way are really excited with the work that some of our partners have done to, in COVID relief efforts and through COVID funding, to step out and say, look, I am typically a health provider, early childhood provider. Give me some money to help families get food in my community. Give me some money to help me address the urgent needs that are happening in my community. And in some cases, not even money, it's been, how can I strategically partner with somebody in my community to address these needs? And so I think that that is a real charge for our partners moving into the year ahead, where there are going to be some new challenges that arise for our families in the aftermath of COVID. And hopefully such resilience is being built now with some of the great work everyone's doing, that we will be in a strong place moving forward.
Thank you very much. Really, thank you so much to all of our panelists for joining us and for sharing your thoughts and your time. I'm going to turn it back over to Allie so she can just say a few words in conclusion.
Thank you, Jean, and thank you, Denise, Ellyn, and Kimberly, for agreeing to be panelists. I think this was a wonderful conversation, and I think it's really important, as Ellyn mentioned, about stressing the fact that collaboration and partnerships and all of us working together is really the only way to work towards the end goal of health equity for all, but especially in today's conversation about health equity in young children. So that is all that we have today, and I will be sending out an email to everyone who attended as well as those who weren't able to attend with some additional information and links, and as well as the survey and the link to the recording for today, so that you can share that with those who missed it, or if you would like to watch, or if you missed some of it. But thank you all for joining us, and thank you again to our panelists and Dr. O'Connor for facilitating for us.
Thanks.
Bye, everyone.
Thank you.
Bye.
Thank you so
Bye.
much.
Thank you.